So you're thinking about becoming an RN. Most people think becoming a nurse is just about getting a degree and passing an exam. But 60% of students who start nursing school drop out or change their majors in the very first year. Why is that? Because nobody tells you about the hidden roadblock that has absolutely nothing to do with science or anatomy. In this video, I'm breaking down the exact step-by-step roadmap to become a nurse, plus the one single thing you must do right now to survive day one. Nursing is one of the most respected, rewarding, and in-demand careers in healthcare. Registered nurses care for patients, work alongside doctors, save lives, and make a real difference every day. But what does it actually take to become an RN? How long does it take? How much does nursing school cost? And what kind of salary can you expect? In this video, I'll walk you through the complete process of becoming a registered nurse, from education requirements and licensing exams to salary expectations and career opportunities. Let's get started. A registered nurse, commonly called an RN, is a licensed healthcare professional who provides patient care, administers medications, monitors health conditions, educates patients, and coordinates treatment plans. RNs work in a variety of settings, including hospitals, emergency rooms, doctors' offices, nursing homes, schools, government agencies, military facilities, and home health care services. On a typical day, an RN might check patient vital signs, administer medications, assist with medical procedures, update medical records, communicate with physicians, educate patients about treatment plans, and respond to emergencies. There are multiple educational routes to becoming a registered nurse. One option is your associate's degree in nursing, or ADN. An associate degree in nursing typically takes about 2 years to complete. Many students choose this route because it's faster, usually less expensive, and allows you to enter the workforce sooner. After graduating and passing the licensing exam, you'll be eligible to work as an RN. Your second option is the Bachelor of Science in Nursing, or BSN. A Bachelor of Science in Nursing usually takes 4 years to complete. Many hospitals now prefer or even require BSN prepared nurses. The benefits of earning a BSN include more job opportunities, higher earning potential, better advancement opportunities, leadership positions, and graduate school eligibility. Your third option is accelerated BSN programs. If you already have a bachelor's degree in another field, you may qualify for an accelerated BSN program. These programs typically take between 12 and 24 months. Which option is best for you? The ADN route is often the fastest and most affordable. The BSN route may provide greater long-term opportunities. Many nurses start with an ADN, begin working, and later complete an RN to BSN program while earning a paycheck. Once accepted into a nursing program, you'll complete both classroom instruction and clinical training. Classroom subjects often include anatomy and physiology, pharmacology, microbiology, nutrition, patient care, medical ethics, and nursing fundamentals. Clinical training places students in real healthcare environments where they gain hands-on experience under supervision. You may rotate through departments such as emergency medicine, pediatrics, labor and delivery, intensive care, mental health, medical surgery. Clinical experience is one of the most important parts of nursing education because it allows students to apply what they've learned in real-world situations. Now remember that hidden roadblock I mentioned at the beginning of the video? The one causing more than half of students to quit before graduation? It isn't the anatomy test, and it isn't the brutal NCLEX. Let's talk about what actually breaks people. It is the emotional and physical exhaustion. No textbook prepares you for the sheer velocity of your first clinical rotation. On day one, you are hit with a brutal reality. Nursing isn't just giving medicine. It's running 12-hour shifts on your feet, fighting a ticking clock, and managing heavy patient loads, all while wrestling with clunky electronic charting systems. Then comes the emotional weight. You will care for people on the worst day of their lives. You will face grieving families, aggressive patients, and understaffed units. The mental strain of trying to stay empathetic while staying accurate is what causes students to pack up their bags. So, how do the successful 40% survive it? They don't just study harder, they learn the art of clinical detachment and radical boundary setting. If you don't learn to leave the hospital stress at the hospital doors, the profession will consume you. Oh, yeah, and don't forget, you will be dealing with bodily fluids. You'll need a physical survival kit, like high quality compression socks to save your legs. But more importantly, you need an emotional decompression routine. A specific non negotiable 15-minute habit after every shift to completely reset your brain. Now that you graduated from an approved nursing program, you'll need to pass the NCLEX-RN. The NCLEX, which stands for National Console Licensure Examination, is the licensing exam required to become a registered nurse. The exam evaluates your ability to safely care for patients and make clinical decisions. Topics will include patient safety, health promotion, pharmacology, infection control, physiological adaptation, and care management. Most nursing graduates spend several weeks or months preparing for the NCLEX before taking the exam. Passing the NCLEX is one of the biggest milestones in becoming a nurse. After passing the NCLEX, you apply for licensure through your state's nursing board. Requirements vary by state, but generally include nursing school transcripts, a background check, fingerprinting, NCLEX results, and application fees. Once approved, you'll officially become a licensed registered nurse. Congratulations, you can now begin your nursing career. Let's break down your first 12 months, starting with the shock phase. Months 1 through 3 are all about sensory overload. You will feel like you know absolutely nothing. Every beep of an IV pump will panic you, and charting will take you twice as long as everyone else. The secret to surviving this phase is simple. Ask 1,000 questions. Preceptors and senior nurses don't expect you to be an expert, but they do expect you to be safe. The fastest way to get fired or lose trust is trying to fake your way through a procedure you don't know. By month 4, you enter the imposter phase. Your orientation is over. You're on your own, and the training wheels are off. You will start doubting your career choice entirely. Your internal voice will tell you that you aren't cut out for this. To survive this, you must rely on your routine, not your emotions. Trust the skills you practice. Anchor yourself to your checklist. Speed will naturally follow accuracy. If you can push through month 6, your muscle memory finally starts taking over. Then, somewhere around month 7 or 8, things change. Welcome to the clicking phase. You'll anticipate a doctor's order before they even write it. You'll handle an emergency room admission without your heart racing. You will finally feel like a real nurse. Every veteran nurse went through the exact timeline. It is a rite of passage. If you know it's coming, you can prepare for it. But knowing the timeline is only half the battle. You need to know how to actually secure your dream job right out of the school. Now let's go into salary and job outlook. One of the biggest reasons people choose nursing is a strong salary potential and job stability. RN salaries vary depending on location, experience, education, specialty, and the employer. New nurses often earn around $60,000 to $80,000 annually. Experienced nurses in high-demand areas can earn well over $100,000 per year. Some specialized nurses earn even more. Examples include ICU nurses, operating room nurses, emergency room nurses, travel nurses, and nurse managers. The demand for nurses remains strong across the United States due to an aging population and ongoing healthcare needs. This makes nursing one of the most stable career fields available today. One of the best aspects of nursing is the opportunity for advancement. After becoming an RN, you can specialize in areas such as critical care, pediatrics, oncology, cardiology, emergency medicine, neonatal nursing, psychiatric nursing. You can also pursue advanced degrees and become a nurse practitioner, a nurse educator, a nurse administrator, and a clinical nurse specialist. These advanced roles often come with increased responsibility and significantly higher salaries. Becoming a registered nurse requires dedication, education, and hard work, but it can lead to a rewarding and stable career helping others every day. Now let's recap. Complete an approved nursing program, graduate from nursing school, pass the NCLEX-RN exam, and obtain your state nursing license. Start your career as a registered nurse. If you're passionate about healthcare, enjoy helping people, and want a career with excellent job security and growth potential, nursing may be the perfect path for you. If you found this video helpful, be sure to like, subscribe, and check out the rest of our career guide videos. Thanks for watching, and we'll see you in the next one.